what is the primary reason? Because people will say people are not practicing safe sex. Other people are, as you pointed out, there is lack of resources or information being distributed regarding HIV. It has taken the backseat to COVID. But is it principally because many people live in denial or don't want to talk about it? Not that they're scared, but parang it's such an unpleasant, ugly, dirty thing to talk about. I'm just quoting all the things that I've heard said about HIV. Is that the problem, that because people don't want to talk about it, so it's not really a social concern?
Well, maliban dun sa stigma, no? As you mentioned, people are afraid or fear about knowing their status. Partly, people don't even talk about sex in general, no? Sa mga pasyente or mga kliyenteng nakikita ko, nami-meet ko every day, even for those who just undergoing testing, no? I ask them if they do inquire or talk about getting tested with their sexual partners or even with their husbands or wives. These kinds of conversation are not tackled, no, in even yung sa between mag-asawa, no. Hindi siya napapag-usapan. So bakit hindi siya napapag-usapan? One, dahil nga yung we perceive sex in general as taboo. So anything na pag-usapan na related sa sex, hindi pag-uusapan, ikahihiya, no? So merong shame in terms of discussing sex. So kung hindi natin madi-discuss yung sex, paano natin i-discuss yung sexual health, which involves getting tested for HIV, other STIs, getting access to protections, preventive measures such as condoms, PrEP, pre-exposure prophylaxis, and then kung hindi natin mapapag-usapan yon, how can we even discuss about treatment for those who will be diagnosed with HIV? So I think yes, malaking part doon yung lack of education, no? Na ako, hindi ko maalala nung ako bata ako, kailan ako nag-start magkaroon ng sex education. It's more of dun sa aking medical school ko na siya natutunan mostly. So what more pa kaya dun sa ating, like let's say, sa public schools, no? So malaking impact yung sa education, no? Multisectoral naman din talaga, no? Yung issues revolving HIV. Kasi aside from the lack of awareness, yung stigma.
What is the prognosis or lifespan of an infected individual? Because I remember back in the late 90s, nag-i-interview na ako ng mga HIV positive individuals. In fact, people were shocked that I would have an HIV positive person in the studio. I would shake hand with them or hug them. And I said, if you know this disease, you know how to deal with it. But I kind of wonder kung buhay pa sila. What is the prognosis or potential of an HIV patient?
Well, definitely buhay na buhay sila as long as they keep themselves on treatment and they regularly monitor yung kanilang status. So, part naman ng ating HIV treatment package sa Philippines is not just providing them with treatment or yung tableta, but part din doon yung regular monitoring nila. Yung annual tests for their viral load, annual tests for their lipid profile or cholesterol levels, screening for diabetes, preventive measures such as vaccinations. So, ang lifespan, technically, walang difference na with someone na walang sakit or may high blood. I think better pa nga yung lifespan ng mga taong living with HIV compared sa mga taong may hypertension na poorly controlled. Kasi pagdating sa hypertension and diabetes, kahit mag-maintenance sila, they can only slow down yung progression ng disease, not exactly halting it. Unlike with HIV treatment, no, it will prevent yung progression ng disease while halting yung activity ng virus. Therefore, hindi maapektuhan further yung immune system. So, for people living with HIV, definitely ang life expectancy nila, makukumpleto nila kung anong inilaan sa kanila ng Diyos, kumbaga. Ang sinasabi ko nga, no, hindi naman sila mamamatay ng dahil sa HIV. Ang ikamamatay nila is kung hindi nila gagamutin yun agad. So yung complications of HIV. So before, like you've mentioned, way back in 80s, no, life expectancy for people living with HIV, especially na-diagnosed na during their AIDS stage, life expectancy is around 2 to 5 years from the diagnosis or shorter, depende sa complications. But now, the goal here is to get tested as soon as possible para habang nasa acute phase pala ng infection, ma-startan ng treatment para maiwasan yung complications. No complications, then better yung life expectancy.
What about those people na sinasabi, may gamot naman eh. Parang may mga diabetes. Yeah, walang problema yan. May gamot naman, di ba? May kung ano-ano. And then, ayun, sex. May gamot naman. But is it sustainable? Is it affordable? Or, kasi as you said, prevention, an ounce of prevention is better than a pound of cure. What about for AIDS and HIV? How expensive is the situation?
Definitely, no, mas ayaw natin magkasakit, no? Kahit anong sakit pa yan, kahit manageable, curable yan, no? As much as possible, ayaw natin magkasakit. But kung magkasakit man, no, so roughly ang gagastusin ng isang taong ni HIV kung simple lang yung kanyang condition, let's say stage 1, stage 2 lang siya, no? Walang complications. Ang isang bote ng gamot would be around, sa Pilipinas, yung na-access natin would be around 1,000 to 1,500 per bottle yon. Imagine you'll have to take 1 bottle per month, no? 1 tablet daily for the rest of your lives hanggang wala pang cure. So just imagine, kung sa ngayon, no, the medicines are provided by the government for free, no? We do have funding support from international bodies, organizations who are helping these commodities to be accessible to us. So pati yung regimen, kung mas complicated yung regimen dahil let's say may mga opportunistic infection,
that was going to be my next question, Doc Migs.
So
because
yung mga may AIDS, no, basically, mas magastos kasi aside from the HIV treatment, they'll have to be treated as well for those opportunistic infections, which would range about 30 to 35,000 on a monthly basis, depende sa mga ginagamot.